Hi there, we are Team Awesome Sauce, and this is our project presentation for our first deliverable. So first let's meet the team. Taking on the role of a lead developer is Carlos and Kamran. Then as a secondary set of developers for the QA role, we have Debasatwa, Tom, and Charlicia. And my name is Evan, and I'm the project manager for Team Awesome Sauce. So first of all, let's start off with what EQUIPPed is. And EQUIPPed stands for Enhancing Quality of Prescribing Practices for Older Adults Discharged from the Emergency Department. So that's quite a mouthful of an acronym, but anyways, it started in Georgia, in Emory, in 2012. And what it is it's a program that has a focus on older patients who have been treated and prescribed medication in the emergency department. And really the goal of this is to give individual feedback to the physicians that are treating these elderly patients in order to help them improve the quality of care that these patients are receiving. So one of the first things we did was we asked, what are the problems that they're currently looking to solve? And there are two main things. One is a smoother workflow when prescribing medicine, and another is kind of upgrading their current feedback system to these doctors. So looking at option one for a smoother workflow, what they have today is a clinical decision support tool, which is made up of order set templates. And what these are is they're templates that are based on the most common discharge diagnoses that older adults are facing. So this has become a group of about 15 different conditions that have been crowdsourced from focus groups as well as patient and doctor feedback. So this information is anything ranging from common antibiotic issues and dosage guidance to things like, hey, you might not want to prescribe drug X with amount Y if your patient has lowered kidney function. And so this is great to have, and what's happened is it's become a one-stop shop for these doctors as they go about their prescribing routines. However, what today in the system, a prescriber, the doctor, the physician, can only look at the order set. Then if they see, okay, I shouldn't be prescribing this drug if my patient has a lowered kidney function, they have to exit that portal, go and check a few different places to see if their patient has a lowered kidney function, and then come back to the prescribing process. So this is not only a disjointed and kind of painful experience for the doctors themselves, but it also leaves a lot of room for human error, which happens and which ultimately leads to a poor treatment for these older patients. So the end goal would be able to get these order sets easily translatable across different systems and to kind of build a FHIR app on top of this, even if it's just for one of these diagnoses or one of these order sets, so that multiple different systems can integrate with this. The second option to kind of fix their feedback system would be to upgrade it and make it more fluid and automated. So today, every month, doctors get an anonymous report that summarizes 1, how many older adults that they saw that month, 2, how many of those adults they prescribed medicine to, 3, how many of those prescriptions were deemed quote-unquote inappropriate, meaning was there a better option, did the physician miss something about the patient's health, and then finally, how is that physician doing as compared to his or her peers? And so obviously that's an anonymous feedback to these doctors and getting them that information to help them improve. But right now it's a clunky system set up in Excel using pivot tables and manually pulling data from SQL. However, they are fairly close to automating it using a system called Tableau. So if at all possible, we would be helping them with the first system, getting a FHIR app set up for these order sets, even if it's just one of those diagnoses. Finally, here's a Gantt chart that sets up our priorities for the coming months, or for the coming weeks rather. And you'll notice that they're split up into 4 colors. Orange shows the kind of background work that needs to happen in order to really get going on this. Green are the heavy coding sessions where we will be testing, developing, and analyzing the quality of our code. Blue is where we will be preparing these presentations, so pulling together this information into a PowerPoint, actually doing the presentation, and then finally red is where we're checking in with our mentors to make sure that we're on track, because the worst thing would be if we're developing something that really is of no use. So with that, Team Awesome Sauce is happy to be a part of this and looking forward to a great semester. Thanks so much.